Welcome back to Digital MD, the podcast where we talk to leaders in the digital healthcare ecosystem about innovation, decision making, and how they think. I'm your host, Dr. Liz Clow, and today I'm thrilled to have Brian Urban with us. So, Brian has received his Master's of Science in Exercise Physiology. He's also done a ton of work as an MBA. On top of that, he is also working on a dual MS PhD at Brown University. So, during his day job and his family life, he is doing a ton of work. He was a research fellow sponsored by the Robert Wood Johnson grant, supporting a lot of different public health research. So, Brian, I just want to say thank you for being here. Your day job is the Director of Innovation and Emerging Markets at FinThrive. Can you tell me what that is and what you do?
Yes, and Liz, thank you for having me on your podcast. This is a true pleasure and honor to be affiliated with all the other great guests you've had on so far. So really excited for your success in
Is that a
podcasting.
cat?
It is. Can you
Mm.
see him?
Great.
That is Bubba. I've tried to have a tuxedo cat with me all the time. We had Bubba 1 passed away. This is Bubba 2. He's a
Oh,
rescue
okay.
as well. So
Well, he's
he's hard.
welcome.
Uh, but yeah, director of innovation and emerging markets at FinThrive. FinThrive is known and becoming really known for its technology power, insights power in revenue cycle management. And where I sit inside the organization is really kind of in two interesting pillars. One is innovation. So coming up with a lot of different marketing, product, and go to market innovation. And that is across about five different segments. And that takes me into the emerging market side of my role, which is facing a variety of really creative executives and partners and thought leaders that are with healthcare tech organizations,
Sure.
ambulatory primary care, surgical boutique centers, virtual care models, device, clinical research organizations, drug manufacturers, health plans, that runs the gamut, which is a lot. And I'm fortunate to have a really great small team to be kind of working it all out and figuring it out together.
That's
And
great.
the fun role, that's for sure.
I feel like revenue cycle management, people always get intimidated by. Could you tell the listeners like what it really does and why we need it in healthcare? Just to like 101, because like you mentioned, all these various people, hospitals, and so why do they need you?
Yeah, finance under healthcare is how the wheels continue to operate in our ecosystem. It's often overlooked or it's often thought of very complicated, but
Mhm.
the finance structure in healthcare hasn't changed a whole heck of a lot in the last several decades, except for the technology side, where more RPA in terms of automation,
Mhm.
AI is starting to come more into play the last 5+ years now. And what we do here at FinThrive is everything from end to end in terms of a claim adjudication process between
Okay.
a healthcare organization and a payer organization. And what's really cool about that is we're starting to have more insights at the individual level that is making, I'd say, the friction a little bit less between payer and provider, and
Mhm.
doing that through reducing the amount of touch points, having a really good play in terms of the remittance from our
Mhm.
claims
Yes.
management product, our contract modeling. It tries to make the process a little more hyperspeed. It helps identify others that have a variety of insurances that helps healthcare and health payers be able to see who's getting paid for what and having the true alignment. So it's helping with the relationship side of it as well. But there's a front end, a mid end, and a back end with revenue cycle management, and a lot of that tech sits within EHRs as well. And we work with a lot of EHR vendors across the landscape too.
That's amazing, and I also think very important because money today in is better than money in 3 months. So, you're helping a lot of companies survive. You're also sounds
Mhm.
like you're working with a lot of different folks to improve the ecosystem, but are you actually using AI? Do you have tools that are automating all of this?
We do. We're starting to build out more of our AI services and actually in a product launch that's happening this year. I think the
Hmm.
really cool thing about the space of revenue management cycle is all the different partnerships that exist in between. So when we did see, as an example, really the milestone in the ecosystem of the cyber attack that happened to change healthcare. They were a
Yes.
clearinghouse. They adjudicate claims. They have back end analytics as well. We do that too, and a variety of other vendors do that. And a lot of people had to come in and help, not as a vulture, but
Mhm.
as a hey, we have to get these healthcare entities back online. Everyone from federally
Yes.
qualified health centers, small primary care centers, to big huge IDNs got impacted and basically sent offline for fear of downstream cyber attacks and other challenges that they might occur with what happening at the time. But we stepped in and helped out in the interim a lot of healthcare systems that we weren't working with initially, and we kind of backfilled a lot of what happened there. So when you think about how fragile the ecosystem is, it does take a very big village to help fill in where maybe big entities have done a
That's
good job
great.
for a long time.
So today I want to make sure we cover a lot of things because FinThrive not only has this data humanity lab, which I want to touch on for the data that you have, but also how you support a lot of the socioeconomic data and how you're elaborating on healthcare organizations to basically effectively leverage their data. On top of that, I also want to ask you later about your own podcast. 'Cause I think that's always interesting, how you have time for that. And then at some point, I want to talk to you about how you manage speaking engagements and how you can juggle your education and all this work. I think you and I love degrees. And so I think we're trying to collect them over time. So we can also talk a little bit about that and how you manage being educated, but managing a family and all of that. So perhaps let's start with as we section in or transition into FinThrive's Data Humanity Lab. Can you tell me about that?
Yes, this is truly a gift to be the architect of. I will give a big shout out to the who have supported the strength and the build of it. Our Chief Innovation Officer, John Yao, Chief Marketing Officer, Cheryl Alden, CEO, Heyman Goyle, Jeff Becker, Sam Foray, Brenda Reed, and TransUnion Healthcare, of course, overall. It just kind of list keeps going. But the definition of our data humanity lab, I like to say, is it's kind of a wrecking ball of
Mm.
two parts. One of learning, it's a learning lab for sure, and then the other part is to really start to advance existing health equity programs that sit within a health plan or that sit within a healthcare organization. And the cool thing that we're delivering is not only data donations from our socioeconomic attribute set from TransUnion Healthcare, but also our services and also in research. So my little
And
team,
just to focus on it,
yeah,
when you say
yeah,
donations, is this free? Free for
it
any
is.
company?
Yeah,
That is impressive.
this is fantastic. We're planning to do 3 donations per year starting in 2024,
Mhm.
and we have 3 lined up that we're gonna start to execute in June, and
Right?
then in 25, 26, and so on. So it's something that's a part of our backbone in terms of an
Mm.
organization, and also something we're hoping others in the space, whether it's competitors or partners or customers, can do something to make a notable contribution, whether it's giving tech resources, labor, intelligence, whatever, something
Yes.
beyond money, and really contributing toward the ecosystem.
So could you talk about in the past, you've had speeches and other discussions about cost savings from SDOH and how these initiatives won't happen quickly. Can you discuss the long-term benefits of investing in SDOH and why this matters to those that need it, to these
Yeah,
organizations that you're donating to? Yeah.
absolutely. And I'll give a really good example when I talk about the Data Humanity Lab in a moment. But as a context into investing into addressing social determinants of health, you're
Yes.
really investing into population health from an economic shift perspective. So you want to right size healthcare, and we really haven't been able to do that across history of U.S. healthcare for many many reasons. But one of the leading causes is seeing the whole picture of an individual being treated, not a member,
Yes.
not a patient, but a person. And most everything that's happening to someone in their life is not in the view of a physician's walls. And you know this,
No, that's true.
um, you've been a practicing physician for many years, and it's tough to want to throw assessments into the laps of providers now to then deliver to their patients. Rather, we can start to look at privatized data that is sitting within credit bureaus or mortgage lending
Yes.
bureaus that are extremely impactful to showing the adverse life events happening to someone, challenges on a day to day, week to week
Mhm.
basis. And where's the crossover with access to care or lack of trust in care or literacy or the appropriate competency and culture is, if it's not there, it's just not going to be fluid.
I
So
love
I
it.
think that's
And
the first piece of let's define it. Then why to invest. I'll go into that.
and I'll just add that I think what's key that you just mentioned too was there is a lack of interoperability. So
Yeah,
this data needs to be integrated into a stakeholder's operating system, like a physician's or nurses, to trigger decision then actions. And these decision actions can then turn into tools that provide better care, whether it's housing or other things or food shortages. And unfortunately, I don't really think we are able to do that right now. The coding necessary to make these interoperable efficiencies exist, but it's not specific enough to highlight the impact of SDOH, especially when also providers are not reimbursed for Z code kind of capture.
right.
So it sounds like you're really playing a key role in this space.
Yeah, and the exciting thing about it is something CMS just released recently relative to the health equity index, how that will impact star ratings in the payment year, which is a little far
Mm,
out, of 2028. However, the data capture and surveys are right now being uh, guided and advised by CMS to start in 24 and 25 to get
great.
a nice repository of information to then how that will be applied in use and then payments thereon after in 28. I think
Hmm,
what's exciting about that is it's CMS now doubling down on their health equity framework, which was developed not too long ago, but now it reaches out into 2032. So they actually had a nice time span of what this journey will look like
hmm.
for the ecosystem to address it, not just healthcare, but I think CMS has finally pushed through the strength of large private and Blue Cross Blue Shield licensees that are health plans and say, hey, you have a lot of power, had a lot of power for a long time. Now we need to start going into a different model of treating your patient and care coordination and identifying
That's
other needs
great.
that are directly connected into healthcare utilization. So that's the health equity index is really cool from a Medicare star rating perspective and how that will start to come into fruition the next several years. But getting ahead of that, we need to get health plans and healthcare comfortable and more
Mhm.
sophisticated with using data that they've never used before. It's kind of a slightly different language. It's aggregate
Yes.
credit data. It is individual income. It is missing utility bills, people passing away, close to kin,
Yes. And some are more
dispersion of
predictive
phone
than
address.
others. I think
Yes.
especially when you're thinking about all these things, some are more predictive than others, especially for the payer. It's really important for them to start to parse out that, with some things like missing electricity bills or there is a next step, which is then homelessness. And then the next step, which is then worsening conditions
Yeah.
of hospitalizations and admissions and ER visits. So it's behooves a payer to actually start to track these things too.
Yeah.
I will say what's also fascinating about the predictive modeling of SDOH data too is that there are preventative measures, it's proactive, it's also personalized, and then it's like
Mm.
at the end of the day, it can also be predictive, but also prescriptive. This is what you should do next. If you are seeing these bills, this is what you need to do to reach out to get this person to cover their expenses and prevent hospitalizations or homelessness.
Yeah.
So I bet there is so much you're looking at right now. And lastly, I'll mention when I was so I'm at Walmart as Walmart Mexico and Central America's board. And what I've seen across the data is that even well, for retail, we're seeing someone that purchases birdseed actually has safer driving techniques and they have fewer accidents. And there's a
Interesting.
correlation to interesting data that you can predict over time if you look at it. And so I wonder if you're doing that right now with this data.
Yeah, I'm glad you asked and shared that example, Liz, because in from an architect perspective, there's an underlying model in terms of using this data, which is making sure you have an individual match. So it's the person you want to analyze and be able to help. That is the
Mm,
person at that that's sitting within that organization, health plan or healthcare. And then what are the key components that this person is challenged with economically? And then you can break it down into affording, access, transportation,
Hmm.
and then you could break it down to one more level, which is where you're going, kind of the behavioral economic standpoint of if they do this, how likely will they be to do that? And a
Right.
lot of what our work has been in these propensity to models, which is like a predictive model, looking at a very large population to have some sort of statistical significance of pointing the direction of this cohort versus that cohort when we're just thinking about a general curve. And what's
Mm.
cool is we're starting to look at our consumer marketing data and our SDOH attributes to say, of these old propensity to pay models, how likely is someone to be able to pay for the healthcare they're receiving? Let's use that architecture and layer on top a behavioral component of saying, how likely is this person to be able to not only engage and use a SNAP program, but maybe get a ride to their next appointment?
Mm.
Or in terms of even looking at a partnership like with Papa,
Right.
how likely are they to have a companion help them be able to sort through their medication, to be able to tie their shoes, to be able to sort through their mail? Very basic things that can be complicated in this population living at home, aging well, senior population, elderly, frail. So that kind of model is something that we've been working on for a while, and it just needs to take more of a full swing into healthcare, and we need those chief technology officers, chief analytic officers, CMOs to say, "Yeah, we're gonna do this," and limit our risk by doing, a data humanity lab project or
Right.
doing something beyond a pilot that's just simply a B2B transaction.
Yeah.
Everyone will make their money and will do well, but we need to get a baseline understanding by doing that. So we're there. We're just got to get it bigger. Yeah.
Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at home testing for health plans. Their convenient, member centric approach has helped plans achieve industry leading results. In just 1 year, Everly Health Solutions helped a multi state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com. I love what you're doing. Before I pivot to the next topic, I just want to kind of summarize. It sounds like we have to figure out how we collect and share and integrate the data, unstructured sources, standardize it, turn it into actionable information. Also, using the data to remove the obstacles that prevent patients from accessing quality care, right? Explore the potential integration of behaviors and next steps for this, looking at all the different data. The next step also is evaluating the results, so
Mm.
looking at it predictively, figuring out what are key performance indicators to track the progress. And to really improve the outcomes, you then have to figure out how to establish reliable partnerships with all those involved, the stakeholders that we mentioned. I talk about the 5 Ps in my book: payers, providers, patients, pioneers, and policymakers. And it sounds like you also work with all of them to promote these changes, which is really important for disruptive digital care.
Yeah, trying to. And I think to your point is how can this be adopted overall? And speed to impact is critically important right now. We can't wait for policy to be passed. We can't sit back and continue to do the business as usual model in healthcare. We have to start taking creative risks and applying them and not just being able to try and fix everything, but find the interventions that are most relative to the populations you're serving, and then
Yes,
put a better data strategy together that isn't claim based, and that's it. Just try.
that's great. Well, I love that topic. I think the next thing I did want to ask is, as you talk about all these, you have all these great speaking engagements and this podcast. Uh, a question I've always had is, how do you prepare for these speaking engagements? What
Mm.
impact do you hope to make? And how do you think about your podcast too? Like, what are you trying to accomplish in it?
Yeah, that is all good questions. In terms of the speaking engagements I have, it's usually facing a group of healthcare technology startups or healthcare finance executives. So those that may not always speak the same data language as I do, and some of my background and experiences I've had. So whenever I do prepare, I look at the audience first, kind of get a gauge on how much do they know? And then, quite honestly, I come out to something fun. I usually come out to like a
Mm.
fun hip hop song. I've come out to Gloria Stefan Conga,
This
uh, Ludacris, Mark Morrison. I've
uh,
come out to everything, and I still have a couple fun speaking engagements coming up in June that hopefully we
that's
can get people
great.
excited moving their bodies before we
Mm,
talk about stuff. And then I'll usually lead in with something intriguing that brings a point to where we are and how we're seeing our individuals that
mm.
we're servicing, whether on the healthcare side or the coverage side or payment assistance side, wherever. And it usually lands pretty well. I try to bring a little bit of uh, levity to a situation that's healthcare finance. So that's it's kind of looking at
It's
the
good.
audience backward and then trying to make some bold comments, get people to do something, not be afraid of it. And
Like a call to
I think that
action.
yeah.
That's really great. For all the things that you're doing, I mean, you balance a lot. You have your day job, your podcast, all these things. How do you do it all? Like, what are your tricks? And you and I have talked a little bit. I think it's useful also to share, to be vulnerable. I think I took time off and I spent a lot of time between med school, between college and med school, even during med school, figuring my life out. I think we all, as humans and individuals, have times that we want to spend more on work. Sometimes it's work and
Yeah.
play. Sometimes it's work and education. Sometimes it's just education. So, how do you
Mhm.
do it
Sure.
all?
Well, a couple of things. First, I am very thankful for the little life I have and the things that I get to do within it. And that's a daily repetition for me. And that's kind of the next thing is repetitions and routine are very important for me and my brain because if I don't have the structure, I will tend to drift. And
Mm,
if I don't feel like I'm in a structured place, I need to call a timeout. Really good example. I love Brown. I love Brown Bears. The Department of Professional Studies is a great place within Brown, a good small community. I started the program actually in December, and then around February, I said I need to take a time out. I'm traveling a lot. I can't be in Providence more more than maybe
mm,
one time every quarter, and it's pretty intense. You gotta be up there a lot.
mhm.
So, I took a pause, and I'll return in December with some more vigor, I think, and some
Right.
energy, in my pockets, but, yeah, I think our connection, we love to learn. My
Mm,
learning path has been somewhat of a crooked one here and there, but I've experienced, state schools, private Christian, and then private elite, and then I've kinda took my own spin
mm,
it's everything. When I was at Dartmouth, I was definitely an oddball. I was not an MD or a PA or an RN or a lawyer.
mm.
I was kind of the pseudo marketing product guy that really was interested in socioeconomic data.
Wow.
And I kind of took that play into how public health can be of a next generation flavor and not
Yes.
just simply be in virology, epidemiology, disease causal pathways, but be in the influential seat and the driver's seat. And I think doing
Mm,
that from a alternative data perspective is where public health should go. So I've always kind of been
mm,
a bit of an oddball, and that's helped, but I kind of live and breathe off of structure, and
mm.
I always need to have that. So that's really the main thing of juggling things. I am a calendar monger. I really am, and I'm sure
That's
that
really
you are in
great.
a lot of ways too with everything that you've done in your career.
I think I'm definitely very lucky. I will outsource things that I need to, and I'm lucky that I have the means to do that, which I don't take for granted at all. But I also definitely, like you said, I structure myself to basically be able to um, run off energy if I need to. In between meetings, sometimes I'll jump on the Peloton. Sometimes I'll do
Oh,
all
yeah.
sorts of things where I'll just do a quick yoga session or a meditation on an app. And I also find myself sometimes needing to just laugh. So sometimes I will put on like a stand-up comedian for 10 minutes and just like I'm never as funny as any of them, but I sometimes will think about jokes and retell them. So, that's been what drives me. It gives me energy. But I also wanna say that it sounds like you have also done something that I think a lot of people are incredible at doing, which is if you can figure out the meaning of your life, which is
Mm,
oftentimes in my mind, is to find your gift, then the purpose of life is to learn to give it away and to share it with the world while you do that. And it sounds like you've really been able to do that both even in the MBA, that's you as an oddball. I was kind of an oddball too. When you go to business school, it's like most people are bankers or consultants, and suddenly it's like this, MD in third year of med school shows up. And so I think we all find our path and we create meaning through it. So I just wanted to share that it sounds like you
Okay.
have really been able to do that. And I applaud you.
Thank you. It's taken me many moons to be able to get to a comfortable place where I feel I can contribute something of note and I'm okay with who I am or who I've grown into as a person. And it's funny, Liz, because in like nursery school, I would always go into in the class with a ton of toys in my cargo pockets at the time. And I was always come home with no toys. I would kind of give them away. I've always loved giving away stuff, not out of obsession, but out of like getting just joy out of people kind of using something that I once had that maybe helping. And the cycle can
Yes.
continue. I've never been able to do that in my little business career and substantiate it. And I've come to that now with the Data Humanity Lab, which is
Mm,
having a very large organization like a credit bureau actually take their data and put it into something good, which all
mm,
credit bureaus objectively, they are able to see so much at an individual level, but they're not applying the data in a helpful way that taking the bottom of our socioeconomic society and pushing them
that's
up.
right.
I think credit scores and lending buying power indexes, they're just all junk, and it does not churn the society in terms of an economic view of where we need to go. So if we can,
Yes.
I think, push Experian, Equifax, all the other major and even small credit bureaus to do something better with their data that doesn't
Yes.
have a dollar sign next to it or a judgment or a ceiling for individual, that's how we can have a more rich, more functioning society and start to close these gaps that we're having everywhere in healthcare, in health and outcomes and life expectancy. Like this is how we break generational poverty in half. So that's
I
something
agree with
that's
that
been really
completely.
fun.
Oh, couldn't agree more, and I think what's really exciting to also hear is that it's data that is underutilized, but if you keep it safe and you have a protected way to share it with the right folk and you don't abuse it and you use it, in a way that support people in the long
Mhm.
run, there's a really, big use case. So, Brian, is there
Absolutely.
anything else you wanna share with viewers before we jump into the hot takes, which is just 5 questions I always ask every guest?
No, I'm excited for the hot takes. Nothing else other than if anyone's interested in the Data Humanity Lab, you can go on to finthrive.com / Data Humanity Lab, and you can find out who our partners are, the data donations we're giving, and the research we're undergoing.
Great. Alright, thank you so much, Brian. So, what is your best advice you wanna give anyone?
Ooh, don't quit. Don't
Mm,
quit anything that you actually care about. Don't ever quit.
okay, great. I agree with that. Although sometimes I do feel like after a while I do wanna quit, but, it makes sense, to maybe also take a break and come back to it.
Yeah.
Um, how about your favorite business or life quote?
Oh, favorite life quote was actually the last one I said was from Jimmy V, the famous
Mm,
basketball coach who said, uh, he was going through cancer at the time. He was receiving an award, I think through ESPN, and he said,
mm,
"Never, the cancer can take my body, it can take my organs, it can never take my heart, my soul, my words. Don't give up, never give up." Paraphrasing. I
I
love
love
that,
that.
and connecting that to my dad. My dad passed away at 55, 20 years ago, and
Mm,
uh, it was so young. I just think he didn't get the chance to live the rest of his life he had, and I think that it's always, like, stuck with me, kind of this part of, like, never being satisfied. It's a good thing, but it's also bad. But, I love that quote from Jimmy V, and I think it applies into business too.
that's so great, and I'm sorry to hear about your dad, but I feel like your legacy is his too, so he's living on through you. Um, what about the hardest challenge and how do you overcome it?
Ooh, yeah, I mean, even with some recent examples in my little career, very difficult to say, hey, let's give away data that we want to make money off of for no cost. Like,
Yes.
put that into what a projected ROI brand equity thing could be. I
Mm,
think you being able to find the right, not necessarily always the right pitch, but the right words to the right people. So you're helping create the influencers that you need to get
yes.
something through the finish line. So it's not always about you delivering this beautiful, articulate presentation, but you need to find the actual influencers on that jury or on that team that's going to pull your idea through. So you don't always have to put so much strength into something. You can find those that will give you strength and help you along. And if you don't find that, I always say go where you're wanted. And maybe that idea is not
Mm,
for that. You take it to somewhere else. Fortunately, we have a very strong culture of supporting each other in FinThrive, and that's kind of worked out with the community lab.
that's so great. I always talk about it the same way in finding your tribe, finding where you resonate with the people that reaffirm what you are driven to do and the motivation that you have. So that's great. What about what's most exciting for you in health tech today?
There's so many really exciting things. I think right now there's a lot of amazing bridge players that are helping health plans start to see the people they're serving in a more holistic way. I
Mm,
always go back to Papa. I love where Papa was developed. Andrew Parker, I think, is a very emerging CEO. He's younger than me.
yes.
Doesn't look younger than me, but
Mm,
he's I think taking a lot of the great training he got Father Randy and what they did at MD Live, and he's taking it to a social care place. And they're putting together a really robust data strategy throughout the rest of this year into next, and how they're trying to help close disparities and actually help health plans achieve financial and engagement success. I love them. I go back to them.
mm,
Upside Health for housing. I think they're fantastic. I love all the primary care centers and technology enabling providers. So Best Buy Health with remote patient monitoring. I
yes.
think like that's the way to go from a retail perspective. Trying to scale quickly in a footprint from primary care just hasn't worked out. Just from a payment infrastructure, there's
That's
probably better
right.
ways. That a lot of lessons learned from a Walgreens and a Walmart that can be applied to get there. But rapid scale for footprint is not where it needs to be right now. We just need to do it in the right way. But I love Best Buy Health and some of the other technology players that are starting to get where they need to go and helping health
Great.
plans.
I agree with that. Absolutely. Last question for you. If you could have any superpower, what would it be?
Oh man. Um, I mean, I would always like to go back in time, but I think I would mess things up.
Oh.
So I don't think I would do that. I think probably having I don't know if it's a superpower, but having like an eidetic memory,
Mm,
especially now with young children. I'm gonna be an old man one day and maybe forget some of these really beautiful, subtle moments. And if I could have an eidetic memory that carries with me, almost like a super cloud-based
good
memory
one.
in my brain, I would
Yes.
I would love that.
I love it. Well, Brian, it's been really a pleasure to chat with you today. Listeners, for more on Brian's work to connect directly, check out his LinkedIn and we will link into the show notes. We also hope today's conversation has sparked your curiosity and inspired you to explore further. Thanks for joining us.
Thank you, Liz.
Thank you. Keep on
Oh, perfect.
innovating.
Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at-home testing for health plans. Their convenient, member-centric approach has helped plans achieve industry-leading results. In just 1 year, Everly Health Solutions helped a multi-state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com.